Okay, we begin with a live look on Capitol Hill today. And in the hot seat, Health and Human Services Secretary Robert F. Kennedy Jr. He is facing tough questions from lawmakers on a number of topics, including recent shakeups at the Centers for Disease Control and Prevention and vaccine shifts. His testimony comes just 1 week after the CDC faced fresh scrutiny over the firing of Director Susan Monterez, along with the resignation of several senior CDC officials that followed it. Then there's this. This is a letter signed by more than 1,000 HHS staffers who say they want the secretary out. They accuse Kennedy of, quote, compromising the health of the nation. Here's how that hearing is going so far.
I don't think Robert Kennedy should be within a million miles of this job. Republicans on the committee had a chance to prevent the public health train wreck that Mr. Kennedy has engineered. Everyone voted for him. It is in the country's best interest that Robert Kennedy step down, and if he doesn't, Donald Trump should fire him before more people are hurt by his reckless disregard for science and the truth. I would ask now that the committee formally swear in Robert Kennedy as a witness.
Senator White and I will personally object and will reject your request. We will treat this witness as we treat all of the other administration witnesses who come before us. And let me just say again, as I said in my opening remarks, we will have some partisan disagreements today. We're having partisan disagreements right now, and I am having partisan disagreements with you on your characterization of the facts. The bottom line is we will let the Secretary make his own case in his opening statement.
I'll only say, Mr. Chairman, that this committee's unwillingness to swear this witness is basically a message that it is acceptable to lie to the Senate Finance Committee about hugely important questions like vaccines. I think it's a great mistake.
And I understand Senator Cassidy is talking right now. We see him there on your screen, so let's listen into what he's saying.
Concerned about liability if vaccines are given to a patient who requests it, but not on the current CDC list. Pharmacists are requiring a prescription now even for patients over 65, creating a huge headache. I submit these for the record.
Without objection.
I would say effectively we're denying people vaccine.
Senator Cantwell.
You're wrong.
Thank you, Mr. Chairman. Following up on that same line as Senator Cassidy, because that's exactly, I represent one of the most science-based states in the country. That is percentage of scientists per capita. And at your confirmation hearing, we asked about this, whether you would follow science. You've made a statement here today in your testimony that you would follow science, and yet you're not following science, and that's what Senator Cassidy's question was. It's a simple yes or no answer. Do you think the president deserves to get a prize for warp speed in the mRNA technology that saved so many lives? And you won't answer that question.
I answered it.
No, you're saying that there are problems with what was interpreted. You could say yes. Do you say yes?
I said the president also deserves a Nobel Prize, but our mRNA vaccines that we're working on, the ones that we canceled, which are for upper respiratory infections alone,
you canceled $500 million of research because the mRNA technology is about continuing the research to be ready for the next flu, influenza, the next pandemic, and you have to do the research.
I'm happy to have a detailed discussion with you about it. You're so wrong on your facts.
You're interrupting me, and sir, you're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. The history on vaccines is very clear. This is the 20th century. That's how many people had vaccines and had illnesses. This is the 21st century. This is the decrease, 99% down to 100%. This is what was delivered with vaccines, and you don't want to support that. You don't want to support that evidence. So yes, the governors of the West, Washington, Oregon, and California, will take up the efficacy of science. Yes, the University of Washington will deliver the science that America will depend on, because you don't want to depend on it. And his own Surgeon General of the Trump administration said over 2 million lives were saved because of the mRNA technology, and you don't want to continue that. You don't want to continue that technology. So what country is going to now take up that technology lead? What country is going to do that, leaving us more vulnerable to some other country keeping the advantage on having the best technology? So I'm telling you, I represent a state that's about technology. I have two other quick questions for you.
These questions or statements? Because I can answer that question if it's actually a question.
Do you believe in having the ACA and the support for the ACA that is about to expire? Do you believe in doing something about that?
In terms of the enhanced premium tax credits?
Yes.
Well, the Democrats had two chances to make them permanent, and they didn't. And they didn't for a reason.
We're the ones who delivered it. So I'm just asking, yes or no, do you want to do something about this? Yes or no?
I want to fix the system, and that's what we're doing, fixing systematically to make premiums lower. That's what President Trump wants to do.
Do you think the women on the steps of the Capitol were a hoax yesterday?
I don't know about any women on the steps of the Capitol.
The women who were talking about Epstein, do you think they were a hoax yesterday?
Do I think they were?
Do you think they were perpetrating a hoax yesterday?
Perpetuating a hoax?
Yeah.
I have no idea what they were saying. This is the first I'm hearing about it.
You're hearing about the women on the Capitol steps saying that they believe that the Epstein information should be made public? That's the first you're hearing about it? What I'm saying is you are perpetrating hoaxes. You, as this Secretary of Health, so you're undermining the whole healthcare delivery system, and you keep trying to point to chronic disease, but you're not putting solutions on the table to cover more Americans, and you're taking away the science and technology that has made us the leader that has saved, according to the first Trump administration Surgeon General, millions of lives, and you don't want to keep that going. So no, I don't support your continued efforts as Secretary, and I definitely think that our colleagues need to rally around science. If you want the Northwest to continue to lead on all innovation and all healthy people, okay, we'll do that. But it's a sad statement for the rest of America and America's leadership on technology. Thank you, Mr. Chairman.
Thank you, Senator Warner.
Clearly a very testy hearing there. We were hearing comments from Senator Cantwell, but now I want to go live to Capitol Hill and CBS News congressional correspondent Nikole Killion. Nikole, thank you for joining us today. This hearing obviously just kicking off, but what has stood out to you so far?
Well, I think everybody's really been looking for an opportunity to get at the secretary, and I think that's what you're seeing unfold in this hearing room, because so much has transpired since he has been here on Capitol Hill, from the upheaval at the CDC to, firing members of a key vaccine panel to, changes in the state of Florida to try to end vaccine mandates. I mean, you name it, it is all on the table here today, but also a lot of frustration on the part of lawmakers. I mean, what you just heard there from Senator Maria Cantwell, even weaving in the Epstein survivors into this, who, of course, they were on Capitol Hill just yesterday, and the president, in the midst of their testimony here on Capitol Hill, said this effort to release the Epstein files was a hoax. So the secretary was just questioned about that. So, I mean, we are just putting it all on the table, to be frank. But look, the secretary has been pushing back quite aggressively against some of these criticisms, most specifically with respect to the CDC and the firing of the CDC director, Susan Menares, as well as the resignations of several top agency officials. He defended those firings, saying that it was the right thing to do. He continues to insist that he is concerned about chronic diseases in this country, that the rates have gone through the roof, and that some of this happened on the CDC's watch. Furthermore, he criticized the agency's handling of the COVID pandemic and said some of these people have to go. So we are, making bold changes. So he did defend those decisions and those firings and resignations that we saw last week, and is not backing down.
Yeah, and Nikole, I think it's very important to point out here that the committee that's holding today's hearing does not have jurisdiction over the CDC, but the Senate Health Committee does. And some members of that group are sounding off this morning. What exactly are they saying?
Yeah, that's right. Well, the main person that we are watching inside the Senate Finance Committee room is Senator Bill Cassidy, who is the chair of the Senate Health Committee. And it's worth pointing out that Senate Finance, part of the reason that Secretary Kennedy is here is because Finance does have jurisdiction over some HHS programs, things like Medicare and Medicaid. And really, this hearing was aimed at examining the president's 2026 health care agenda. So that's the real focus here. But again, because so much is bottled up and so much has been happening with respect to public health over the last several weeks and months, many lawmakers are also using this as an opportunity to try to get some of their questions answered here. But Senator Cassidy, so many different names today. Senator Cassidy, he is certainly one to watch because he has said, in light of the moves at the CDC, that he believes that there should be greater oversight. So we're kind of looking to him to see how he presses the secretary on this matter.
Yeah, a lot of names, a lot of people, a lot of questions. And speaking of that, we've heard some of the questions so far from the senators. But what do you expect Kennedy will face during the remainder of this hearing?
Well, you will have to see how long that this hearing goes on. It could go on for the next several hours, or it could end relatively quickly. Who knows? One thing we do know, kind of getting back to the point about the Senate Health Committee, I do know that, many members of that panel are closely watching what happens here, because at the end of the day, they certainly have the power to call the secretary back to testify. In fact, the ranking member of that committee, Bernie Sanders, has also called for the now fired director of the CDC, Susan Menarez, to appear before the panel. He also would like to hear from some of these workers and agency leaders who resigned. So again, a lot of members of that committee are watching this hearing to decide their next steps.
Okay. CBS News congressional correspondent Nikole Killion, thank you so much. And we will continue to watch this hearing for you and bring you any updates as we get them.